Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to be talking to you about the dangers of steroid injections. These injections are commonly used for pain relief, and this week we're going to learn about safer alternatives, including regenerative medicine. You're going to get some great information today, and you're not going to want to miss this one, so stay tuned. Okay, Dr. Mike, a lot of patients are still coming into the practice. They're seeing the orthopedist. They're getting recommendations for their steroid injections for pain control. In this day and age, with all the current research that shows that, over time, these injections may provide some short-term pain relief, but can actually cause more damage to the tissue that they're injecting. Why is this still a treatment option for patients? It's kind of frustrating.
It certainly will be frustrating again for the average person. They don't really know the pros and cons to the treatment options, and then the doctor gives them an injection and it seems like it gives them relief, and certainly they'll go back to actually getting that injection.
Yeah.
It's still standard of care, unfortunately, because it's been around for a long time and it's been used for numerous years. And there are different types of cortisone, there are different kind of brands out there, but bottom line is we group it all as a cortisone, which is an injectable steroid.
Yeah.
Prednisone is, as it sounds the same, cortisone and prednisone is the oral steroid. So people use that for various reasons for systemic relief of inflammation. So they've been around for a long time and there are purposes behind it. Unfortunately, as you mentioned, the key is that it gets injected too often.
Yeah.
If you got an injection when you were younger, if you had one time because you had an acute flare of a big swollen joint, we can't fault anybody for that because we can get someone relief quickly. It's worthwhile to get that relief, get the inflammation down for somebody because you're looking for short-term benefit.
Yeah.
But when we're looking for a chronic condition, chronic arthritis, person who has a joint arthritic problem in their knee or their back as specifically, we see all the time, to keep on going back over and over and over again, it's just too damaging to the tissue that gets injected.
Right.
Just think about it. If you have a back problem and you've gone to your pain clinic and gotten an injection, what do they usually tell you? Well, we can do this up to 3 times a year and then that will be good for you. Well, what they don't tell you is 3 times a year was kind of put into place because we know if you do it too often and more than 3 times a year, occasionally some clinics sneak by with 4 times, which even, again, pushes the buttons. The reason of not doing it more than that is because it causes harm to the tissues you're injected. So the medical system has put a little restriction on it to say, we're not going to allow you to get more than 3 per year. And as you know, sometimes the injection goes in and a person might get relief, but they may get 6 weeks of benefit. They may get 4 weeks of benefit. Well, the doctor's not going to give you another injection in that 4 or 6 weeks later. It's because they have to wait longer because they're restricted to 3 times a year because of the potential harm.
Yeah, and anytime the doctor or the AMI sets a protocol on the limitations of an injection because it causes harm, you're probably going to want to think of some alternative options of something else that you can do. And we really strive to educate our patients that there are options. So, for example, those Wharton jelly stem cell allografts are a great alternative because now you have a cellular injection that is really designed to help repair damage. There's no harmful side effects. A PRP injection or a platelet-rich plasma injection, similar. Oftentimes we'll use it in combination because the PRP has a lot of growth factors. Or sometimes if you have a younger patient that has a lot of stem cells, we can get away with just using the PRP injection to help the body, repair the damage itself. And again, to us, that just seems like the absolute no-brainer first choice treatment option that you're gonna wanna look at. We just had a patient yesterday, an 89-year-old patient with lower back surgery. She gets epidurals every 3 to 4 months. It's insane. And I saw the light bulb go off when I explained to her and her granddaughter. We look at that, we saw the damage in the spine, and I said to her, I think it's about time that we start looking at additional treatment options that aren't gonna cause more damage, that are gonna actually help repair some of the damage, correct?
Absolutely, and if we think about looking at some of the science that's coming into place, there are many laboratories out there that actually trying to create products that simulate PRP.
Sure.
That actually identify some of the growth factors that are in there, the enzymes, these chemicals that are produced by our cells that fight against inflammation. And that's because the system knows, the healthcare system knows, that we have to get away from the cortisone. Unfortunately, there's not a lot of products out there. There's not a lot of ability to kind of utilize things that aren't present, so cortisone may still be given. But if anything, at least should be kind of aware to the patient that you have to say, well, I've received these injections a little too frequently, or the doctor's recommending it so often. Are there other options? And there are, as you mentioned in our clinic with the Wharton's jelly allograft, the PRP from a person's own blood products. So we do have options, and looking at other alternatives that we can provide, just so you don't have to just be stuck in injection after injection after injection, which can be problematic in the future.
Right, and more importantly too, Medicare has recognized this. Last year, they started covering the Wharton jelly allograft, or those stem cell injection, which is a big game changer. And I often like to point out too, at those pain centers where they're doing their injection, they're just doing the injection. And when we look at our clinic, where we combine the medical care, the chiropractic treatment, and the physical therapy, we're really making sure that when we do these injections, we're making sure that we're identifying the root cause of the patient's problem. Because as you and I both know, it doesn't matter what you inject. Obviously, if you're injecting something harmful, you're gonna wanna look at something more conservative. But if you're not identifying the root cause of the patient's problem, you're not gonna see that improvement. These injections, the Wharton's jelly allografts and the PRP are wonderful tools in our practice, but you need to make sure that you have the aftercare to make sure that we get those joints moving, to work on your flexibility, to work on your strength and your balance, to correct those abnormal movement patterns. And that's really what differentiates Maragal Medical from the rest of the typical orthopedic or pain management clinics out there.
Yeah, let's be clear, as you just mentioned, when the person's going for the injection and looking for the improvement, well, the injection center, the pain clinics that really are just doing the injections, they're saying there's improvement because your pain went down.
Yeah.
Well, we're not looking at reducing your pain only. We want to reduce your pain for sure.
Right.
But now we got to get you moving, and that's what you just mentioned. We can incorporate the other services right here in our clinic to make sure that we instill upon that person that there's work to be done on your end.
Yep.
If you can get movement and do the exercises and mobilize the joints with the chiropractors, get the physical therapy strengthening, you may not need another injection for 3 months or 6 months or longer, or we are looking at ways to just keep the injections at a minimum, because that's the key. The improvement is actually functional improvement later.
Right.
It should not be just pain control, and that's where some of the problem gets lost. You know, people do feel better when they have less pain,
Sure.
but it's too short-lived and it's not really helpful in the long term.
Exactly. If you'd like more information about our clinic, you can look us up on the web at maragalmedical.com. And remember, folks, we take most insurances. Well, that's it for today. I hope you were able to learn something. Everybody have a great day, and we'll see you soon.
Take care.